In the early 1980s, the world was about to face a medical mystery unlike anything seen before. A silent killer, spreading through communities with no known cause, no cure, and no mercy. This is the story of how AIDS was discovered, how it devastated millions, and how science finally fought back. The story begins in June 1981, Los Angeles. Doctors reported something strange. 5 young, previously healthy homosexual men, all suffering from a rare type of pneumonia, pneumocystis carinii pneumonia. This disease usually attacked people with extremely weak immune systems, cancer patients, the elderly. But these men were different. They were young, they were healthy, and suddenly their immune systems had collapsed. Within months, similar cases appeared: unusual cancers, strange infections, rapid weight loss. Doctors were confused. The disease was new, mysterious, terrifying.
This is the report from the CDC that was published 40 years ago in 1981, describing a pneumonia-like disease in 5 gay men in Los Angeles.
By late 1981, hundreds of cases were reported in New York and San Francisco. Doctors suspected the disease was infectious, but no one knew how it spread. People were scared. Rumors and stigma grew. Soon, the disease was seen not only in gay men, but also in hemophiliacs, heroin users, sex workers, and newborn babies. It became clear this was not a gay disease. This was a human disease. In 1983, French scientists made a breakthrough. They discovered a new virus attacking the immune system. They called it HIV lymphadenopathy-associated virus. A year later, American researchers found the same virus and called it HTLV-3. In 1986, the world agreed on one name: HIV, human immunodeficiency virus. The mid-1980s to early 1990s became the darkest period. Millions were infected. There was no treatment, and people diagnosed with AIDS were expected to live only months. Communities demanded action. Researchers worked day and night. Governments were slow, but pressure grew. The world needed hope. In 1987, the first drug was approved in America, AZT. It slowed the virus, but it wasn't enough. Side effects were severe. People still died. Then came the scientific miracle, 1996. America announced a new strategy called HAART, Highly Active Antiretroviral Therapy. For the first time, combinations of drugs attacked HIV from multiple directions. People who were dying started to recover. Hospitals emptied, lifespans increased. AIDS had not been cured, but it had been transformed from a death sentence into a treatable chronic condition. Today, thanks to antiretroviral therapy, people with HIV can live long, healthy lives. Transmission can be reduced to almost zero, and scientists continue working toward a vaccine. And one day, a cure. AIDS changed the world, reshaped science, medicine, and society. From 5 mysterious patients in 1981 to millions saved by modern treatment. This is the story of how humanity learned, suffered, fought back, and continues to fight.